What is your name and what sports do you play?
My name is Annie and I do cheer.
So my name is Dana Bally. I am on the women's varsity soccer team.
Easy Mboko, and I play football.
My name is Emma Horner and I play soccer.
My name is Juliana and I play soccer.
My name is Justice Allen and I am a member of the men's varsity football team.
One.
I've had 4 concussions.
One that I know of, but I'm sure probably more.
Just one that I know of.
Only one.
I've definitely had about a handful, only one recorded.
Athletes around the world are being told that the concussions are minor, but are they really? Recently, the Centers for Disease Control have released new and updated guidelines regarding the care and treatment for those who suffer from mild traumatic brain injuries, otherwise known as MTBIs or concussions. And this has made it to the news. Dr. Andrew Karagu, a medical director of the pediatric ICU, notes that concussions are too often dismissed as minor, but in reality they're an acute brain injury and they should be treated as such. Noticeably, concussions are on the rise globally as there is an increase in the amount of athletes participating in harmful contact sports where concussions are a substantial risk factor. Many of these athletes are susceptible to concussions and they are not aware of the detrimental short-term as well as long-term consequences on the developing brain. The CDC reports that the amount of reported concussions has doubled in the last 10 years, and it's estimated that 5.3 million Americans live with a disability as a result of a traumatic brain injury. You may be wondering, what exactly is a concussion? Essentially, a concussion is a brain injury that occurs when the brain comes into sudden contact with the inside of the skull. It is a result of a direct blow to the head or a blunt force applied somewhere else to the body. There are several symptoms associated with a concussion, but they tend to differ between individuals.
Faint.
An immediate headache.
I was sensitive to light.
Sensitive to sound.
Nausea.
I had memory loss, blurry vision.
Other symptoms that are common often include cognitive impairments such as slow reaction times or feelings of fogginess, emotional symptoms such as irritability, and other changes to behavior. In terms of diagnosis, concussions can be clinically diagnosed, but it's also important to note that symptoms may not arise immediately after an injury, so it is critical to get assessed by a physician if you think you may have a concussion. A neurological examination can be performed where a physician will assess several components such as vision, hearing, sensation, motor control, and coordination. A cognitive test is similar and it involves your doctor examining things such as memory and concentration. In order to get an accurate image of the brain, imaging techniques such as CT scans and MRIs are often used. Furthermore, EEGs and fMRIs can be used to monitor brain activity. Brain injuries can be very scary, but there are many ways to prevent them. In terms of sports, protective headgear such as helmets or other equipment such as mouthguards are recommended to be worn and worn properly. As well, following the rules of gameplay is often key. Proper techniques and playing rules should be taught to all athletes who are participating in contact sports. If you have suffered from a concussion, there are lots of things your doctor may suggest to you. It is common to be told to get lots of rest and you'll probably need this anyways. Avoidance of any kind of thinking or concentration-provoking activities is highly recommended, and this includes things such as reading, studying, or any kind of screen activity. Furthermore, most doctors will recommend limiting any kind of physical exertion. Medical management may also be recommended by doctors sometimes, and this may include taking acetaminophen-based painkillers such as Tylenol. Essentially, concussions can change the brain, and they can change it in several ways. The 3 main categories of long-term effects on the brain include cognitive impairment, neurological mechanisms, and structural anomalies. In regards to cognitive impairment, several studies have found that people who experience multiple concussions score much lower on memory performance activities than their baseline scores before injuries. The scores were also much lower in comparison to those who have suffered from only one concussion. Furthermore, several studies also show that concussion decreases and suppresses long-term potentiation, which is the mechanism that aids in learning and memory formation, and this is correlated with multiple concussions. Several studies with empirical data illustrate that people with concussions demonstrate motor system dysfunction associated with the inhibition of the primary motor complex M1 in the brain. Results illustrated a strong positive correlation between the number of repeated concussions and the level of inhibition to the primary motor complex. When the brain experiences traumatic force, it has been found that there is a sharp increase in calcium ions moving into the neuron, which promotes neuronal suppression. Research suggests that this hypermetabolic period may be a risk factor for secondary injury syndrome, where the subject is more susceptible to another concussion. Therefore, without even seeing any morphological changes, severe metabolic defects can occur from multiple concussions if encountered within a certain period of time. In one study, the imaging results showed progressive cortical as well as hippocampal atrophy and enlargement of the lateral ventricles. In another study with patients who suffered from mild traumatic brain injury, acute and chronic reduction in the prefrontal gray matter thickness was very evident. Chronic traumatic encephalopathy, otherwise known as CTE, is a degenerative disease of the brain. This is thought to be caused by repeated brain injuries to the brain and are often seen as a result of sports. In terms of return to play guidelines, many sources and doctors will recommend different timelines, so it's hard to give a concrete timeline. In general, however, the stages that can be followed for return to play protocol include starting off with no physical activity and refraining from all sports. Following this, light exercise and then sport-specific exercises are recommended. The athlete can then move into non-contact practice, followed by full contact training, and then can they return to play. Overall, empirical data suggests that concussions impact the developing brain in numerous ways. In conclusion, the Fox News article did an accurate job at conveying the message that concussions are not a minor health issue, but a major one, and multiple concussions have long-term effects on the brain. Next time you experience a concussion, be sure to get assessed by a physician in order to prevent any long-term damage from occurring.